Something shocking that I learned about biotin supplements. Welcome to our second newsletter in this new and enhanced format, which is a video format. I hope you enjoyed the first one. Obviously, comments and feedback are always welcome. So I'm going to share with you a shocking finding about some of the common day supplements that we take. We're going to talk about biotin at the end of this newsletter. But firstly, what's been happening in clinic? A lot of treatments. It's been a busy couple of weeks. I think we're heading into the summer, so sometimes people are going away on holiday, so we don't get to see you as often. But a common treatment that we've been doing is wrinkle relaxing injections with Botox, botulinum toxin type A, and also other forms as well, like Azilur. But what we're finding is that obviously leading into a holiday, patients are concerned about static lines, whether it's on the forehead, frown lines, or around the eyes. Especially when you're squinting in the sun, you don't really want to have those frown lines there, or if you're getting annoyed with the stresses that summer holidays bring, you definitely don't want those frown lines creeping back in. So what we always say with treatments with Botox or wrinkle smoothing injections is that we want to treat movement, we want to treat dynamic lines, so the lines that appear when we are moving our face, but not necessarily dynamic lines, and we want to treat static lines predominantly. So another popular treatment in clinic has been dermal fillers. And again, we don't see patients regularly for this, and lip fillers is the most common one. We might see you every 6 to 9 months, probably 9 months. But when we're doing full face rejuvenation, when we're correcting for facial volume loss, for example, at the temples, lines down here, volume loss here, and then that leads to volume loss in the lower parts of the face, we might only do a treatment every 12 to 16 months. So although it's a great treatment, really effective, I don't get to see you as often. Now, that has been a very popular treatment, seeing a lot of patients coming back. It's that time of year again, it's that dermal filler time of year. Another popular treatment has been skin peels. Even if it's the summer, we want to get a good exfoliation of the skin and then strengthen it, make it more resilient. Patients are noticing pigmentation is appearing, and we can try and dampen down that pigment response by using things like peels. And what that's doing is it's helping to not only smooth out the surface of the skin, but reduce melanocyte activity. And then obviously I'll give you guidance on what kind of sunscreen and skincare to use. So finally, I was going to share with you something shocking that I learned about biotin supplements. Now, biotin is often recommended for skin, hair, and nails. Not something that I've actually recommended very often in clinic. I am an advocate for supplements, but what we found in biotin supplements from doing research and actually listening to some very eminent professionals, especially dermatologists, is that we don't actually need that much. We can actually get a lot of it from our diet. And what we're finding in supplements is there's huge amounts in there. The daily requirement for biotin that we should be able to get from food like egg yolks or meat sources is that you only need about 30 micrograms. So it's a very small amount. But what we're finding in a lot of supplements that there's huge amounts in there, maybe up to 1,000 milligrams in one dose. So why is that shocking? What's the problem? Well, it interferes with blood tests. It can interfere with thyroid blood tests. It can interfere with normal hematology blood tests. But the most shocking thing was that it can actually interfere with cardiac blood tests. So, for example, patients who are on high doses or kind of normal off-the-shelf doses of biotin who were getting chest pain, it was interfering with their cardiac markers when they're going to hospital. So there's a blood test called troponin, and biotin can actually interfere with that. So a lot of heart attacks were being missed, and I think more information is needed. So that's why I'm sharing it with you in this newsletter. So as always, I hope you found this informative. If you'd like to drop us a comment, feedback, we always welcome it. And I hope it's been informative, and I look forward to sharing more information about Vysana, about clinic, about what I'm doing during the week with you again.